most famous physical therapist on the internet.
Hi, folks. I'm Bob Show, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
That's right. I mean, in our opinion, of course, Bob.
Today we're going to talk about the 3 easiest and reliable tests for ACL rupture without scans.
Right.
This is the anterior cruciate ligament we're talking about.
Right. So, and these are scans that, doctors, therapists use, no MRI, although that's oftentimes
Usually what they
confirmation.
first, they diagnose it and then they usually have a scan
Exactly.
afterwards. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to Bob and Brad. Go to the giveaway section. We're always giving something away. What we're giving away, we don't know.
We don't. Oh, it's a future video.
Yeah.
Future.
So check it out. Let us know. Put it in the comments what the giveaway is. Go to Facebook. It'll also be pinned to the top of the page, the contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Yes.
And Brad, what do we have?
Podcasts are out now. This one won't be on a podcast.
No, this won't be a podcast.
No, but we've got a number of good ones out there. Okay, so Bob, there's a lot of manual ways. In other words, you can test for ACL. These are probably the most common. And I know the third one, the lever sign, some recent studies showed to be very high in reliability. So we're going to go through this.
And I don't know that one.
Yeah.
Lever, L-E-V-E-R.
Yeah, or Lily. It's from Dr. Lily.
Okay.
And we'll talk a little more about that when we get there. So we're not recommending that you as the layperson do this, although you could.
Right.
You're not going to hurt anything
right.
if you do it the way we show you. But it does take a little bit of a feel.
Right.
And the more patience, more knees you get with your hands, you get much better at it.
The other thing is you don't test it right after the injury.
Right.
There's pain and swelling there. The person won't be able to relax.
Right.
It'll hurt. I mean, I remember a fellow classmate in physical therapy school hurt his knee in basketball game, and we're like, he was too painful. You couldn't test him.
Yeah, you're anxious.
There's swelling.
Yep, and your muscles tighten up, contracting, protective mechanism. And the other thing is, I've always do it. I know a lot
most people do.
Test the good knee first.
Yes.
Then you get a feel for how lax the person is normally. In other words, what the feel. We'll talk about that too. So
yeah, you might have a person that's really loose jointed, and you go through their good knee, and that really has a lot of movement.
Yeah.
Because the ligament helps hold the bone to bone. So if
we're going to show that with Sam I Am here, the skeleton.
Okay.
So anyways, why don't we show what the ACL actually does? We got Sam's knee tore apart here. So here we've got the tibia and the femur, and where the condyles connect to the joint is. Now, there's 4 primary ligaments that stabilize the knee. You got the MCL, the LCL.
So basically hold this bone to this bone and stop it from...
Yep. Now, the ACL, anterior cruciate ligament, and the PCL, posterior cruciate ligament, are inside the knee, inside the joint, and they cross each other. That's why it's cruciate.
That's cruciate,
Yep,
cross.
So it makes that cross. Now, the anterior ligament, its responsibility is to hold the tibia from moving anterior or forward like this. Now, if the ligaments are intact, there's typically a little bit of movement like this, but it'll stop. If the ACL is tore, it becomes much more. Now, obviously, it's not
that much.
Not that much.
Yeah.
And that's where it does take a little bit of a feel. So that's the job. That shows the mechanics of it. Hopefully, that's clear to everyone.
Yep.
It clears mud.
That's right. There we go.
So let's take Sam out of here, and then we're going to put Bob down, and we're going to do the tests on Bob's knee. Okay, ready?
Yep.
1, 2, 3. Oh, be careful. Careful on the spine. There you go.
Yeah.
Boy.
We'll put his leg back on later.
Yeah. You better give it to the dog, something like that. There you go. Okay, so the first one, Lachman's. Now, I think this is probably after a surgeon, too. I'm not sure. But with Lachman's...
It certainly sounds that way.
Lachman's, I'm going to show it on this.
On this leg?
Yeah, why don't you just hop off, Bob, quickly. Sure. I forgot. I need a little more room on the backside. It's just going to be easier for me to do it and people to see. Again, you're going to do this on the good leg first. This is the way I always like to do it. I put my knee underneath here, and that way the patient typically feels more
exactly.
relaxed. Yep, and we get everything relaxed, ask the person to relax. And then what I like to do is I take this finger and my thumb and I go over the joint line. I'm going to expose Bob's leg.
There we go.
Oh my goodness. He's got a fine looking leg.
Yeah.
Yep. Look at the VMO muscle. You've been working out, Bob.
Yeah.
Okay, so the joint line is below the kneecap right here. I'm going to palpate or feel that. I'm going to grab the tibia right here. I'm going to pull it forward. Now, if you zoom in on this, Tanner, I can feel translation or movement of the tibia against the condyle of the femur. Can you feel that, Bob?
Yeah, I feel a little bit. Yep.
And I'm feeling for what we call an end feel. When it comes up and it stops, does it feel like it's a hard end feel, like you're coming up against a, my old instructor would say, brick door,
Sure.
or does it feel spongy, like, and that takes feel.
Yeah.
And I can feel some movement, and you got a healthy ACL here, Bob?
Healthy ACL.
Okay, so then we do
compared to
this
the other
one,
side.
and that's why you want to test the good one, see how that feels compared to the other side. If you can do this and you can feel that motion is clearly more on the other side, and there's no hard end feels like it just keeps wanting to go if you could pull harder.
Right.
That's a good indication we got a ruptured ACL. Okay.
Or maybe just a strained one that was
Right.
pulled.
Partial tear,
Yeah,
something of
partial
that
tear.
nature. Now, the anterior drawer, that's the next one. Obviously, it's not after Dr. Drawer.
Right.
It's just the name of it. You bring the patient's leg up like this, and this works good on something soft
Right.
because you sit on the foot. And I always tell the patient, I'm going to sit on your foot. I'm
Yes.
doing that on purpose. I'm not
Yes.
doing it to get you
Yeah.
upset with me. And here, this might be a little easier to see. Now, if the hamstrings are tight,
Right.
this isn't going to work.
Right.
So getting the
gotta
patient
be
to
relaxed.
relax. Yep. So if you go in with an ACL injury and the doctor or the therapist is doing this, you'll understand exactly,
Right.
and you'll be a better patient. And then, tell them Bob Brad said so. Anyways, now my thumbs are going to go over the joint line and feel it. I'm going to grab behind the tibia here on the back side and in the popliteal fossa, if there's any PTs out
Sure.
there or students. Did I tell you, one of my classmates emailed me on our website.
Oh, really?
Yeah.
What was that?
Yesterday.
Oh.
Yeah. Graduated in 96. He still remembered me.
Oh, wow.
Good job, Corey. All right. So I'm going to pull out here, and I can feel translation. Now, can you see if you go in close on there? And we're going to look at this tibia, and we're going to see if we can see some movement. Bob is not, I can definitely feel it. But there are some knees, healthy knees, that you will definitely see a clunk. Bob,
Right.
he's old, so he's tightening up, No, but seriously, if you got a high schooler,
Yeah. You'll get some motion.
yeah, you'll usually see more motion. So that we don't have one of those examples here.
Right.
But that's the anterior drawer. So we're looking for that. And actually, when you do the PCL, you push the other direction.
Sure.
PCLs do not rupture very often. It's
That's
almost,
the posterior cruciate
Yep,
ligament.
that's the other cross.
The other
Yep.
cross.
Mhm.
Right.
Now this last one.
We need the board?
Yep. You can do this on a bed, I never did this one practicing because
Right.
it is a newer one, but I like it because it's not real hard and it's got real good reliability. And you don't have to use a hard surface, but I'm going to because I think it's going to give a better feel, and that's what one of the studies that I looked at.
Siding from your house?
Huh?
Is this siding from your house?
Well, yeah. Well, you got to make do. You just can't waste things, Bob. R&R, reuse, recycle, and I can never remember what the third R is. Regurgitate.
Yeah.
Okay, so we're going to look at the ACL here, all joking aside. Now, again, this was from Dr. Lilly. Did I mention that? The Italian surgeon?
No, you didn't mention it yet.
Okay. Do you remember me saying that, Tanner? Anyways.
You said it before.
Yeah, and he's, I don't know if he's retired now or not, but he did over 18,000 ACL surgeries, and this was his go-to test.
Sure.
Evidently. Now, they talk about putting a fist underneath here.
Underneath
There, on this side of the knee. So we're going to go here, and then we're going to push down here. Now, I'm going to use, instead of a fist, I'm going to use a towel roll. It's tightly
Sure.
rolled up. And I think we're going to have good results. Plus, I can go on this side so
Sure.
you can see what's going on. So what we're going to do now, remember the ACL prevents the tibia from moving up. So I'm not going to move the tibia this time. I'm going to move the femur and put
Down.
pressure down.
Interesting.
Now look right here. Now this would be a negative sign. In other words, the ACL is healthy. If you push down and the patient's completely relaxed, watch what happens right here at the heel. It lifts up. If the ACL is ruptured, what's going to happen, instead of the heel lifting up, the tibia is going to go up. And so you can focus here. Now, I'm going to hold here, and we'll see if we can get some translation here, if we can see it. So are you relaxed,
Yeah,
Bob?
I'm relaxed.
Don't fall asleep, though. We're working. Yeah, boy, you don't. I think this side's a little tighter than the other side.
Probably is.
Did you?
No, I never.
There's no history with these joints.
No.
Here, let's just
You
try.
want to try once?
Well, I'm going to try one of these and see if it. I would say this side feels
It is
tighter than that side.
I would say too.
Yeah.
I would say too.
So, and this is something, if you're a student or if you just want to play with this on healthy people,
Right.
to get a feel for how
the
it is
more
put
knees you work with, the more you'll get that sense of feel and
Absolutely.
what's normal and
Yep.
what's not normal, and your palpatory skills get better. And
There you go.
so,
And yeah, it's all fun, That's why we like therapy. It's something you can work with and be fun and stay healthy. So
remember, Brad and I can fix just about anything
except for
a broken heart.
yeah,
But we work on it.
and this ACL thing has got nothing to do with the heart, so we're not going to include this in the chapter.
All right, thanks.
Be careful.